Chronic tympanic membrane perforations continue to pose challenges in otolaryngology, especially among pediatric populations and in resource-limited settings. Traditional tympanoplasty, while effective, often requires general anesthesia, graft harvesting, and postoperative recovery, making it less ideal for certain patients. A new development in bioengineered tympanic membrane regeneration is changing that landscape. Researchers have created a collagen-based tympanic membrane patch designed to stimulate native tissue regeneration. This innovative patch integrates biodegradable scaffolding with bioactive growth factors to facilitate self-healing of the eardrum, much like skin wound healing. The procedure is minimally invasive and performed under local anesthesia in an outpatient setting. No graft harvest is required. Once applied to the perforated membrane, the patch initiates a healing response, promoting cellular migration, collagen deposition, and epithelial closure. Clinical trials have shown hearing outcomes comparable to traditional tympanoplasty, with added benefits of reduced surgical risk and recovery time. This makes the patch particularly valuable for pediatric cases, patients with contraindication to general anesthesia, and those in regions with limited access to surgical care. In addition to improving accessibility, this technique represents a paradigm shift from surgical reconstruction to biologically guided regeneration. By harnessing the body's natural ability to heal, this patch offers a promising alternative that is both effective and patient-friendly, opening doors to broader adoption and better outcomes in eardrum repair.